If you are over 60 and you have been feeling tired for no real reason, swelling a little around your ankles, or just feeling off in a way you cannot quite explain, please do not look away from this video, because what I am about to share could be the early warning your kidneys are sending you right now, and most people miss it completely until it is too late to ignore. Hey everyone, welcome back to Dr. Bennett. If this is your first time here, this channel is all about helping you understand your body in plain, simple language, no confusing medical jargon, just real talk about real health. So if that sounds like something you need in your life, go ahead and hit that subscribe button right now before we get started, because we put out videos just like this one every single week. And trust me, you do not want to miss what is coming next. Now let us talk about your kidneys, because honestly, they are some of the most underappreciated organs in your entire body. Most people only think about their heart, or their brain, or maybe their joints as they get older. The kidneys quietly do their job in the background, filtering waste, balancing fluids, controlling blood pressure, and keeping your blood chemistry stable, and they do it every single minute of every single day without asking for any credit. But here is the problem. Kidneys are incredibly good at compensating for damage. They can lose a significant amount of their function and still manage to keep things running smoothly enough that you feel mostly normal. That is exactly why kidney decline is often called a silent condition. By the time symptoms become obvious, a lot of function may already be gone. And after 60, this risk goes up significantly because of decades of wear and tear, blood vessel changes, blood pressure issues, and the natural aging process itself. So today, I want to walk you through the warning signs that your kidneys might be struggling, the ones that are easy to dismiss as just getting older, but that you really should not ignore. We are also going to talk about why these signs happen, what is going on inside your body when they show up, and when it is time to actually pick up the phone and call your doctor. Stick with me until the end, because the last sign we talk about is one that almost nobody connects to kidney health, and it might be happening to you or someone you love right now without anyone realizing it. Let us start with one of the most common signs, and that is fatigue. Now I know what you are thinking. Everybody feels tired sometimes, especially as we get older. Sleep changes, energy naturally dips, and life gets busier with grandkids, appointments, and everything else. But there is a difference between normal tiredness and the kind of deep, persistent exhaustion that does not go away, no matter how much rest you get. When your kidneys are not filtering waste properly, toxins and impurities can build up in your bloodstream. This buildup affects nearly every system in your body, including your brain and muscles, which can leave you feeling drained, foggy, and weak even after a full night of sleep. Many people also develop anemia when kidney function declines, because healthy kidneys produce a hormone that tells your bone marrow to make red blood cells. When that hormone production drops, your red blood cell count can drop too, and that means less oxygen circulating through your body, which translates directly into fatigue that feels different from anything you have experienced before. The second sign to watch for involves changes in how you urinate. This one is incredibly important because your kidneys are directly responsible for producing urine, so changes here are often the clearest clue something is going on. Pay attention to how often you are going to the bathroom, especially at night. Needing to urinate frequently during the night, a pattern doctors sometimes call nocturia, can be an early sign that your kidneys are having trouble concentrating urine properly. On the flip side, some people notice they are urinating less than usual, or that the amount feels reduced even though they are drinking the same amount of fluids. Also watch the color and texture. Urine that appears foamy or bubbly can be a sign that protein is leaking into it, something that should not normally happen with healthy, properly functioning kidneys. Urine that looks unusually dark or that has a pink or reddish tint suggesting blood should never be brushed aside. These changes do not automatically mean something serious is wrong, but they are exactly the kind of clue that deserves a conversation with your doctor and a simple urine test to check things out. The third major warning sign is swelling, particularly in your legs, ankles, feet, and sometimes even around your eyes in the morning. When your kidneys are not functioning at their best, your body has a harder time getting rid of excess sodium and fluid. That extra fluid does not just disappear. It pools in your tissues, especially in areas affected by gravity, like your lower legs and feet, which is why this kind of swelling tends to get more noticeable as the day goes on. If you press a finger into the swollen area and it leaves an indentation that takes a while to bounce back, that is often referred to as pitting edema, and it is a pretty clear physical sign worth mentioning to your healthcare provider. Some people also notice puffiness around their eyes when they wake up, which can happen because protein is leaking from the kidneys into the urine. instead of staying in the bloodstream where it belongs, allowing fluid to shift into the surrounding tissue. Now let us talk about something that surprises a lot of people, and that is the connection between kidney health and blood pressure. Most of us think of high blood pressure as a heart problem, and it certainly does affect your heart. But your kidneys and your blood pressure are deeply intertwined in a two-way relationship. Healthy kidneys help regulate blood pressure by managing fluid balance and releasing hormones that control how tightly or loosely your blood vessels constrict. When kidney function starts to decline, this regulation system can become unbalanced, often leading to blood pressure that becomes harder to control, even with medication that used to work just fine. At the same time, uncontrolled high blood pressure is one of the leading causes of kidney damage in the first place, which creates a frustrating cycle where each problem makes the other worse. If you have been managing your blood pressure for years and suddenly notice your usual medication is not keeping it in check anymore, that change is worth bringing up with your doctor because it could be related to what is happening with your kidneys. Another sign that often gets mistaken for something else entirely is persistent itching, sometimes called pruritus. This is not your average dry skin itch that lotion fixes right away. When kidneys are not filtering waste effectively, certain minerals and waste products, including phosphorus, can build up in the bloodstream. This buildup can trigger itching that feels deep, widespread, and stubborn, often affecting your back, arms, and legs, and it tends to get worse at night. A lot of people try every cream and moisturizer on the shelf without realizing the itching might be coming from the inside rather than the outside. If you find yourself constantly scratching with no clear skin condition to explain it, and moisturizing does not seem to help much, that is worth mentioning at your next checkup. Muscle cramps are another sign that tends to fly under the radar, especially because so many people associate cramping with simple dehydration or just sitting too long. But when kidneys struggle to keep your electrolytes, things like sodium, potassium, and calcium, in proper balance, your muscles can react with cramping, twitching, or spasms, often in the legs and especially at night. If you find yourself waking up repeatedly with painful leg cramps that did not used to happen, and changing your hydration or stretching routine does not seem to help, it is worth considering that your kidneys might be struggling to maintain that delicate mineral balance your muscles depend on. Let us talk about appetite and taste changes next, because this is one people rarely connect to their kidneys at all. When waste products build up in the bloodstream due to reduced kidney filtering, it can actually affect your sense of taste, often producing a metallic or unpleasant taste in your mouth that was not there before. This same buildup can suppress your appetite, sometimes leading to unintentional weight loss. Food that used to taste appealing might start tasting bland, off, or strange, and you might just find yourself not wanting to eat the way you used to. Some people even develop bad breath that has a distinct ammonia-like smell, which again traces back to waste products that are not being filtered out properly. If you have noticed your appetite shrinking along with strange taste changes, particularly if this has happened gradually over weeks or months, this combination is worth discussing with your doctor rather than dismissing as just getting older. Shortness of breath is another sign that deserves real attention, especially because it can be confused with heart or lung issues, which is exactly why doctors often need to investigate kidney function alongside those other systems. When kidneys cannot remove excess fluid from your body effectively, that fluid can build up in and around your lungs, making it harder to breathe, especially when lying down or during physical activity that used to feel easy. Anemia related to kidney decline, which we mentioned earlier, can also contribute to breathlessness, because with fewer red blood cells circulating, your body has to work harder to deliver oxygen to your tissues, leaving you winded after activities that never used to bother you. Now here is one that almost nobody talks about, and it is trouble concentrating, sometimes described as brain fog. When waste products accumulate in your bloodstream because your kidneys are not filtering efficiently, those toxins can affect brain function as well as the rest of your body. People sometimes describe this as feeling mentally slower, having trouble focusing on conversations, struggling to remember simple things, or just feeling like their mind is wrapped in cotton. Because this kind of cognitive fog is often blamed on normal aging, stress, or lack of sleep, it frequently gets overlooked as a potential kidney-related symptom, even though it can be one of the clearer signals once other causes have been ruled out. And finally, let us talk about sleep, because trouble sleeping is surprisingly connected to kidney health. And this is the sign I mentioned earlier that almost nobody links to kidney function. Restless leg syndrome, a condition that causes uncomfortable, sometimes irresistible urges to move your legs, especially at night, has been associated with kidney decline, possibly related to those same electrolyte imbalances we talked about with muscle cramps. Sleep apnea, a condition where breathing repeatedly stops and starts during sleep, also appears to be more common in people with reduced kidney function, and the relationship seems to go both ways, with poor sleep potentially worsening kidney health over time, and kidney issues potentially worsening sleep quality. If you have been tossing and turning, dealing with restless legs, or waking up gasping for air, and you also have some of the other signs we mentioned today, it is worth bringing all of these symptoms together in one conversation with your doctor rather than treating them as separate, unrelated issues. So why does all of this become more relevant after 60 specifically? As we age, the kidneys naturally lose some of their filtering capacity, even in people who are otherwise healthy. Blood vessels throughout the body, including the tiny ones inside the kidneys, become slightly less flexible over the decades, which can reduce blood flow and filtering efficiency. On top of that natural aging process, conditions that become more common after 60, like diabetes and high blood pressure, are two of the leading contributors to kidney damage worldwide. Long-term use of certain medications, including some pain relievers taken regularly over many years, can also place additional strain on kidney function. Add in the fact that many older adults do not drink quite as much water as they used to, sometimes because thirst signals become less reliable with age, and you have a combination of factors that makes paying attention to these warning signs especially important during this stage of life. So what should you actually do if you are noticing one or more of these signs in yourself or in someone you love? The first step is simple. Do not panic, and do not try to diagnose yourself based on a video, including this one. These signs can overlap with many other conditions, and the only way to know what is really going on is through proper testing. The good news is that checking kidney function is usually straightforward. A simple blood test can measure creatinine levels and estimate something called the glomerular filtration rate, often shortened to GFR, which gives your doctor a clear picture of how well your kidneys are filtering. A basic urine test can check for protein or blood that should not normally be there. These tests are quick, widely available, and often already included in routine annual checkups. So if you have not had blood work done recently, this might be the perfect reason to schedule that appointment you have been putting off. There is also a lot you can do proactively to support your kidney health, regardless of whether you are currently experiencing any of these signs. Staying properly hydrated helps your kidneys flush out waste more efficiently, though if you have been told to limit fluids for another health condition, always follow your doctor's specific guidance rather than general advice. Keeping a close eye on your blood pressure and blood sugar levels, especially if you have diabetes or hypertension, protects the small blood vessels inside your kidneys from unnecessary strain. Being mindful about how often you use certain over-the-counter pain medications and discussing long-term use with your doctor can also make a meaningful difference, since these medications, while safe for occasional use, can place extra burden on kidneys when used frequently over long periods. Reducing excess sodium in your diet supports healthy blood pressure, which in turn supports your kidneys. And simply showing up for your regular checkups, even when you feel perfectly fine, allows your doctor to catch subtle changes in your blood work long before you would ever notice symptoms on your own. I want to be really clear about something before we wrap up. Noticing one of these signs does not automatically mean you have a serious kidney problem. Fatigue can come from dozens of causes. Swelling can come from circulation issues. Itching can come from skin conditions that have nothing to do with your kidneys at all. The point of this video is not to scare you, but to make sure you are paying attention to your body and taking those signals seriously enough to get checked, rather than brushing them aside as just another part of getting older. Early detection genuinely matters here, because when kidney issues are caught early, there is often a lot that can be done to slow things down, protect your remaining function, and help you keep living the active, independent life you want for yourself. I really hope this video helped you understand your kidneys a little better and gave you some practical signs to watch for in yourself or in the people you love. If you found this helpful, I would love to hear from you in the comments. Tell me which one of these signs surprised you the most, or if you have noticed any of them in your own life recently. I read through the comments regularly, and honestly, some of the best topics for future videos come directly from what you all share down there, so do not be shy. And if you have a parent, a spouse, a sibling, or a close friend over 60 who you think needs to hear this, please go ahead and share this video with them right now. Sometimes the people we love the most are the ones least likely to bring up small symptoms like these on their own, and a simple share from you could be the nudge that gets them to finally schedule that checkup they have been putting off. Before you go, if you have not subscribed yet, now is the perfect time, because next week we are diving into a topic that ties directly into everything we talked about today. Something involving your heart and your kidneys that almost nobody connects until it is too late. And trust me, you are going to want to see that one. So hit that subscribe button, turn on notifications so you do not miss it, and as always, take care of yourselves and the people you love. I will see you in the next video.